Hello, my name is Dr. Carlos Guanche. I'm a shoulder specialist with nearly 20 years of experience at the Southern California Orthopedic Institute. The symptoms that patients typically should see a doctor for are increasing stiffness in the shoulder. A lot of patients have night pain that really doesn't get better with rest, ice, and anti-inflammatory medications. And a lot of patients also have had several cortisone injections, none of which have really improved their symptoms to any great extent. So those are the most common symptoms. The most common patient that's treated for shoulder replacement surgery is that patient that has severe arthritis. Having said that, a lot of patients will have not only arthritis but also a rotator cuff tear. And in those situations, sometimes we'll need a slightly more complex procedure, which is called a reverse shoulder replacement. The difference between the standard total shoulder replacement and a reverse shoulder replacement is that in patients that require the reverse total shoulder, they are patients that have both severe arthritis as well as a rotator cuff tear that is unrepairable. In those situations, most patients have had several cortisone injections, they've had several courses of physical therapy, and they really haven't made any significant improvement with any of these non-surgical treatments. The advantages of a reverse total shoulder replacement are that patients who have severe disability of their arm, which is something called pseudoparalysis, meaning that they can't really lift their arm above their shoulder, go from not being able to use their arm for simple things such as even doing their hair or doing their makeup, to being able to really effectively move their arm above their shoulder and are able to really do lifting and day-to-day activities that they haven't done in a long period of time. The typical recovery process for a standard shoulder replacement surgery is that patients come in the morning into the hospital, the surgery takes place, it lasts about an hour, they're usually in overnight in the hospital. The next morning, they usually are able to start using their arm effectively for eating, for paperwork, for computer work. They usually see us back in the office about 10 days later, and that's when we start physical therapy. They go to physical therapy twice a week for about 3 months. By the end of 3 months, most patients are very happy with their function and are back to doing all of their activities.